Welcome to Medica 2021 with a year in Düsseldorf or in your hometown. We're going to kick off Medica with one of the first web sessions and talk about Germany's healthcare industry and market over the next 30 minutes or so. My name is Markus Schmidt and I'm the Director of Chemicals and Healthcare at Germany Trade and Invest. I'm joined by my colleague Gregor Kemper, who will cover the analytics and diagnostics area in a little bit later. Just as a very quick reminder, as an introduction, Germany Trade and Invest is the economic development agency of Germany. There's many things that we do, but I'm going to keep it very brief. There are two main tasks that we follow. We provide German companies with information about international markets, and we also assist international companies in setting up operations in Germany. With that, I would like to highlight very few key numbers about the German healthcare market. This is just a very, very rough overview. I hope you understand that in this very limited time, I cannot go into detail for every single sector, but we're going to focus on some key and trends in a little bit so that you see what's happening and what we can expect in the near future. So very briefly, healthcare expenditure in 2020 equaled or exceeded a little bit 417 billion euro. That was roughly 403 billion last year. That equals, the 417 equals 12.5% of GDP. That went up from 11.7 the previous year. That's probably not a big surprise given the corona pandemic. Health insurance, of course, is still mandatory in Germany, and the numbers haven't changed a whole lot. 90% of the people still have public health insurance and 10% elect private insurance. The number of hospitals continues to decline as it has over the past 2 decades or so. But of course, this number is still very high by international comparison. The number of physicians is actually rising. We now have more than 400,000 working medical professionals in Germany. The number of pharmacies, in contrast, is slightly decreasing. Because we cannot go into detail for every single subsegment, I've included a number of links. We'll make the presentation available, so you don't have to take pictures of this or write these links down, of course. We have links, as you can see, how the German healthcare system works if you're interested in the rough layout, because it's not a national health system run by a ministry. It's a slightly unique system if you're not familiar with Germany. Of course, we have key data about the various sectors, let's say medical devices and consumer healthcare and pharmaceuticals, biotechnology, digital health, all available on our website, gtai.com/healthcare. I've also included links to some recent articles we published about the life sciences industry in Germany. There's some testimonials from international companies, as you can see, and I also included some links to videos that we produced over the last 2 or 3 years. But again, you're going to find further links also on our website, and probably a lot of information that you might find useful. With that, I would like to highlight some key trends and drivers in the healthcare sector. And I picked 4 topics. First one is biotechnology and pharmaceuticals. Then Gregor Kemper is going to join me for diagnostics and analytics. We'll talk a little bit about digitalization, and finally automation and robotics. Let me start with biotech and pharma. Last year during Medica, we're right in the middle of the corona pandemic. Hopefully, we're still in the pandemic, but hopefully more towards the end. When the pandemic started last year, of course, companies around the world were trying to find solutions, medications, vaccines. There was a lot of effort, and luckily the German government supported these efforts fairly quickly. They supported international programs to develop vaccines, but they also invested in 3 individual companies, BioNTech, CureVac, and IDT, and turned out to be quite a good investment. Total sum for all 3 companies was 750 million. And in the case of BioNTech, as you're certainly aware, they were successful in developing a vaccine based on mRNA technology, one of the fastest vaccine developments in history. Quite a complex endeavor, given that it's a new technology. Of course, with their partner Pfizer, the vaccine is being used around the world. So this had quite an impact on the German biotechnology and pharma sector. First of all, we see much higher awareness of the German biotechnology landscape right now, not just domestically, but internationally as well. And you know, if you think maybe only 2 years ago, except for specialists, hardly anyone knew biotechnology companies by name, and now it seems to be more like household names. And as a result, we also see funding go up tremendously, both private, but also some government programs. So there's much more support for the industry and awareness about the industry. Next effect, since mRNA is a new platform, but it proved to be successful, of course, it's quite promising for future applications. So we might see new medications and vaccines. BioNTech, of course, is focused mostly on oncology. So we might see some exciting developments in this field, but could be entirely other applications, of course, as well. So it's not the only company working with this kind of technology. And finally, what we've noticed in this little time is also that there's an entirely new form of cooperation going on internationally. I was amazed to hear that BioNTech worked not only with people from 60 different countries, but they worked with 150 partners and signed more than 1,200 contracts with them. So extremely complex, but you see that the boundaries between partner, competitor, they're changing. They're entirely new patterns to collaborate, and despite this enormous complexity, they were able to speed up this process and bring the product to market very quickly. So I think we're going to see a lot more in this field and new forms of cooperation internationally. I'm going to keep it to this for the moment, and with that, we're going to go a little bit more into detail regarding the diagnostics and analytics industry in Germany, and I would like to ask my colleague Gregor to join me now for the next couple slides. Thank you.
Thank you, Markus. Today, I would like to talk about the diagnostics and analytics market and industry in Germany. First, I'm going to show some, current statistics, current data that illustrate mostly how the pandemic has been affecting these 2 industries, especially the diagnostics market in Germany. And after that, I'm going to talk about some current trends, developments, and events that are relevant for the diagnostics and analytics landscape in Germany. First, about diagnostics, this being, of course, a key aspect in fighting the pandemic. I think it's not overly surprising that in times of the pandemic, the diagnostics market in Germany experienced quite a substantial growth from 2.1 billion euro in 2019 up to 2.7 billion in 2020. That's a 27% growth year on year. And I suppose it's pretty safe to assume that the key driver behind this was the intense activity of COVID-19 testing, especially antigen testing in testing labs all over Germany. Now, what does this market look like in detail? Of this market of 2.7 billion euro, as I mentioned, the vast majority, about 87%, is accounted for by the reagent segment, and the rest, the remaining 13%, are mostly, for example, devices and other components and services. What does the reagent market look like? Well, not overly surprisingly, in 2020, the biggest subsegment was the one of infectious immunology reagents, which accounted alone for over a third of the reagents, followed by the two subsegments of immune chemistry and clinical chemistry. Further smaller segments were hematology, microbiology, and the very small segment of genetic testing. Now, of course, it's an interesting question to ask which of these segments of the diagnostics and IVD market accounted most for the growth that we've seen in the past year. Well, if you take a look at the reagent market in total, actually in the past few years, sometimes it had pretty much stagnated or even decreased, but now 2020, it experienced this 28% growth. And if you take a look at the drivers behind it, it was mostly the infectious disease reagent segment, which almost quadrupled from 2019 to 2020. And this pretty staggering increase was not the only, but the main driving force between the increase in the reagents and then the total diagnostics market. But as I said, it's not the only reason. For example, the instrument and consumable segment also increased by 17.5% in volume. And also the services spare parts part experienced some growth. So basically this huge trend in the infectious disease segment, again, being an effect of the pandemic leading to growth here. Now, the analytics segment is, the analytics market is, of course, a quite wide field. It can encompass the industry that basically produces products for medical testing laboratories, but also the industry that supplies anything for the life science research sector. And this is actually a quite sizable industry in Germany with a revenue of 2 billion euro. It's only slightly smaller than the diagnostics industry. And this industry employs over 12,000 people in Germany. It not only provides products and services for the life science research, but also carries out a lot of research itself. 12% of the revenue is reinvested into new developments and innovation. When the pandemic started in late 2019, many people in the analytical, biologic, and lab technology industry in Germany were quite concerned about it and worried that perhaps their client companies might decrease their investments in research projects, or that, for example, testing labs might have less business and therefore might need less of their products, and were therefore rather cautious about their prognosis for 2020. But in hindsight, it turned out that the market proved to be quite a lot more robust than anticipated. Actually, in 2020, the analytical, biologic, and lab technology market experienced a revenue plus of 1.9%, a part of which was due to the rather strong export. Only the staff slightly decreased by 0.5%. Now, today, the estimates, the expectations according to surveys for this year are pretty positive. So it's things are anticipated to be looking up this year. The companies in the industry expect a plus of revenue of 8%, so pretty solid growth that is carried pretty much in equal parts by domestic and international sales. And also the staff is anticipated to more than recover. One important pillar, as I mentioned, of the German, laboratory technology and also medtech export is the entry of emerging and highly dynamic markets such as the Southeast Asian. Here you can see that, for example, from 2010 to 2020, the export to Southeast Asia from Germany increased by over 85%, making this one of the most dynamic and fastest growing partners of Germany in this space, in this segment. Now, as I said, I'd like to talk a bit about important current events in the diagnostics and analytics space. And the elephant in the room for this topic is, of course, the antigen testing that is provided in Germany. Until October the 11th, everyone in Germany was entitled to getting free antigen tests at testing centers. And overall, the German government spent 3.5 billion euro on this. There has also been quite an impact in the approval of new tests. Since the beginning of the pandemic, 14 tests to be operated by non-medical professionals received approval to be marketed via an accelerated mechanism. But the vast majority of the tests that experienced market entry in the past years were POC tests, which are the ones that are also used in the testing centers. Over 400 of them started being marketed often by international suppliers, international companies, or their German subsidiaries. So this was, of course, quite an opportunity for diagnostics manufacturers and their suppliers throughout the world. Now, the big question is, of course, how did the end of free antigen tests impact the sales and the market chances of these diagnostic tests in Germany? Now, as of now, it's a bit too early to give a definitive answer, but I've taken the look at the number, the official figures for COVID-19 antigen tests that were and PCR tests that were carried out in Germany in the past weeks. And unfortunately, I've only got data for the first week after antigen tests being free. And this suggests that the decrease in demand for tests and test centers seems to be not that strong. So you see that in the week 41 of this year, the number of tests that were carried out was just slightly lower than before, even though people had to pay for it. Maybe part of the reason might be that there are some groups of people, for example, children, pregnant women, and people who are not medically eligible for vaccination can still receive their tests for free. Another important topic is the IVDR. Most of you probably know that the IVDR is a European regulation for the European market for in vitro diagnostics. It exists along with it medical device twin, the MDR, and is aimed at harmonizing the European IVD market, but it also requires the manufacturers of IVDs, including the ones that are already on the market, to adapt their products to the new rules. Now, just this month, October 2021, the European Commission proposed a modification of the deadlines to make existing products conform to the new standards. Now, I have to add that this is just a proposal, so it doesn't have any effect yet, but if it should have an effect, that would mean that the manufacturers of IVDs that are already on the market are going to have more time, 1 year or several years, to have their products conform with the current requirements. How many years exactly depends on the risk class of the individual product. So this is, of course, an exciting topic, and the European manufacturers of IVDs will have a close look at how the developments are and if anything like this will be enacted. And with that, I would like to pass the mic back to Dr. Schmidt.
Thank you, Gregor. And we're going to keep on going, cover the next topic, digitalization. We don't have too much time left, so I'm not going to go into detail for all those topics listed here. I just want to mention briefly the effects of the corona pandemic on digitalization. Digitalization, of course, started well before the pandemic. It's not a new topic; it's been ongoing. Luckily, it's many big projects were started before the pandemic. But nevertheless, we have some effects, and I think the first one is a much better understanding and acceptance of digital tools due to corona. If you think about, even let's take telemedicine, for example. It was possible before the pandemic. Not many people used it. They prefer to see doctors in person. But of course, during the pandemic, it's a huge asset, and suddenly, was appreciated by many more patients, doctors, and others. So there's much better understanding. Same for, if you think about public health departments, reporting infection numbers and so forth. Now, if you call for more funding for certain systems or IT systems, there wasn't much urgency before, but this has entirely changed. Everybody understands digital tools are necessary, systems are necessary. Everybody needs to be on board. It's not good enough if only a certain number of hospitals or public health departments is connected. Everybody needs to be on board. So those nationwide rollouts, getting everybody on board, there's much more pressure politically, and the government is providing additional funding to get there. If you just think about the Hospitals Future Act, for example, that is providing up to 4.3 billion euro this year. There's another webinar at 2:30 today about Germany's digital health market, trends and market opportunities, where we're going to go into much more detail. So if you're interested in digital health, I suggest that you join this web session this afternoon. It will be hosted by my colleague Harald Müller, our digital health specialist, and he invited Flying Health Consulting and Incubator in Berlin for an interview. Whoops. There we go. Final topic, automation and robotics. Another big topic here at Medica. As you can see, automation is a huge topic in all sorts of respects. I also included medical device manufacturing as a topic for automation. That, of course, you will not see that much here at Medica, but especially in hospital settings, there's a lot that can be done to improve efficiencies by automation. Surgery is another quite exciting field. Of course, many people know Da Vinci, but there are many more companies active in this field, and it goes hand in hand also with imaging technologies. So a lot of digital applications in this field. We've also worked with quite a few rehab and prosthesis manufacturers over the last few years. Number of international companies that entered the German market and were able to get on reimbursement lists with very innovative products, quite exciting. And finally, the care sector, where we see robots slowly but surely enter the area as well. I don't think that Germans are quite ready. I don't think Germans are quite ready to accept robots instead of nurses to provide care. But what you can do is you can have nurses focus more on patients, but by providing them with help, let's say for deliveries, there can be automated delivery systems and so forth, so that the nurse is not wasting time on many tasks that really have nothing directly to do with the patient, but are just necessary in the background. So quite exciting fields. There are two more web sessions I would like to point out also today in a little bit. 11:30. Gabriel Fleming, our medical device specialist, will talk about Germany's hospital market, and he also invited guest speakers. Same with Julia Albrecht, who will focus on Germany's medical aids or Hilfsmittel market. She's going to talk about trends, partnering opportunities, but also reimbursement. Will be joined by a guest as well. Yeah, we're coming to the end. I want to wrap up. As I said, unfortunately, we don't have time to go into details for every single subsegment. I learned last year when we did the first recording that we had listeners from not only many countries, but all sorts of backgrounds and different industry sectors. So it's hard to address every single topic that might be of interest. But just as a quick reminder about what we do and where we might be able to help, what we do for international companies that are interested in entering the German market and setting up business in Germany, we can provide a lot of information. That is market information, of course, but also, let's say, about industry clusters, who's working on what. We know a lot of databases also where you might find a lot of useful information. For example, what hospitals specialize in certain fields. We have contacts to other advisors and so forth. So if there's anything, please don't hesitate to ask us, and we can see if we can be of help. We also provide legal information, but not individual legal consulting. That's of course what law firms do. But we give an overview, let's say about the labor market or how to set up a company, how that works, what kind of legal forms they are. And so forth. Same with tax information. We give you the rough layout. You know, how does it work in Germany? How high are the tax rates? How do they vary by region? And so forth. Incentives, financing, of course, a big topic. We have a team just specialized on these topics. There are hundreds of funding programs out there. They're sometimes a little hard to identify. So we can navigate you through and point out the programs that may be relevant and lucrative for you. Yeah, and as I mentioned before, introduce you to local partners wherever we can. And of course, part of our core business is when you're ready to set up your company in Germany, whether it be sales, research and development, production, we guide you through the entire site selection process. We'll work very closely with the various German states. I included my contact details, but the easiest way, if you're attending Medica and as a live person, will of course be to see you, to see us here on the fairground in Düsseldorf. Our booth is in Hall 15. It's K33, fairly easy to find, and we're happy to hear from you. That's going to be it. Unfortunately, we're out of time, but I wish you successful Medica and good luck with your business. Thank you very much.